Hello, this is Dr. Chris Bellin, the APFA medical advisor. I got an update for you today, and CDC had some good information. We want to get it out to you. We must continue to work together. It's amazing what's happening with the cooperation internationally, politically, and with business. We're adjusting to this new normal. This new normal is going to be from weeks to months, depending on how we bend this curve, and if there's reoccurrence throughout the world, we won't know till we get there. We're adjusting to this new normal. There's over 325,000 cases today, and 14,000 people have lost their lives due to COVID-19. Every loss of life is absolutely a tragedy. We need to take that motivation and double down and work together to bend this curve that we've been talking about. We learn something new each and every day. The medical community is amazing. With the information, we do have the best medical care in the world right now. We know the vast majority of people that do come down with COVID-19 are going to do just fine. 80% will have minimal to no symptoms at all. 96 to 99 at the end of the day are going to do just fine. They're going to recover. But that's 4 to 1% that can pass away from this. And if lots of people in the United States and the world get this disease, that number could be huge. So we do need to celebrate some of our successes. 2 days ago, Wuhan, China had 0 cases. So they went from being the highest now to the lowest. So there could be a beginning, middle, and end like every epidemic since the beginning of time. We need to learn from other people, and we need to get to that end for us. Older people are hit hard, but younger people are not spared. They're not invincible. They get sick, they get hospitalized, they can die, and they can get others sick that are in those high-risk categories. Countries with weaker health systems are very vulnerable. Places like India and Africa need to watch that closely. And healthcare professionals are learning from each other. From every new patient that is seen, we're learning something new. During this difficult time, it's very important that you take care of yourself. You need to take care of yourself physically and mentally. Now, heaven forbid you do get COVID-19. You need to have a healthy immune system to be able to fight it off. You need to eat healthy and nutritious. Try to avoid things such as alcohol or heavy caffeinated sugary drinks. And if you smoke, quit. We know those people that do smoke have a much worse outcome with COVID-19. And exercise. World Health Organization recommends 30 minutes a day or an hour for kids to get outside. If you can't get outside, run, work out, bike. If you can't get outside, then do something inside. Watch a video, do yoga, work out, walk up and down the stairs if you need to. If you're working from home, make sure you don't just sit there in that same position. Get up and walk around every 30 minutes to an hour. Get that circulation going. Mental health is really important right now. If you are feeling depressed or confused or scared, that's totally normal. You are a normal person in a very abnormal situation. So what you could do and what you need to do is reach out to your friends, your relatives, communicate. Social media works good, Skype, phone calls. If you need to, there's medical support for you, your primary care manager. There's employee assistance program. There's doctors on demand. There's medical, primary care manager. You could go to JetNet. They got some good resources there for you. Accolade is also available. Listen to music, read a book. Try not to read or see too much news. It really is depressing. It can get you anxious. Try to go to maybe once or twice a day and get updated information. And for any definitive medical advice, I refer you to your primary care manager and manager medical for definitive policies and procedures. Those will be coming out later. In my next video, we'll talk about some of those policies and procedures. We will get through this. We'll get through this together. Let me know if you have any questions. I wish you all the best. Doc, bye now.